Welcome to the 2023 Environmental Health Summit. This is a virtual recording on the environmental health programs and services here at District Health Department number 10. If you have questions about this presentation or environmental health, please reach out to our team via the contact information on the last slide.
So our agenda for today is covered right here. We're going to be going over a number of different programs and services. We're going to be talking about what environmental health is, what it's involved in the U.S., a little bit about our team, services, a variety of our programs, including our largest ones, our well and septic program, and our food safety program, and also some special services and programs that we offer through environmental health. So environmental health really means a lot of different things to a lot of different folks. It's really broad. And I'll have a short video clip coming up here in the next slide that kind of encompasses, more specifically kind of a broad spectrum what environmental health is, but think of it like it's a dynamic system where we are going to protect the environment, air, water, soil from physical factors that our population or people, industry place on the environment. And on the flip side of that, because of all those stressors on the environment, there's also sources of concern, dangers, environmental threats, contamination from our environment that we could potentially be exposed through industry and a variety of other practices. So environmental health is also protecting and ensuring our health and a safe working environment where we can all live, work, and play and grow.
The things that impact our health aren't always visible right in front of us. We all live downstream from a range of environmental factors that travel down to us and end up in our communities, homes, and bodies. By ourselves, we can't control all the things that happen in upstream environments, but there are people, highly trained environmental health workers, who specialize in monitoring the upstream conditions that shape downstream health effects. This behind-the-scenes team includes a wide variety of committed professionals, from research scientists who study how traffic moves in dense urban settings, to community planners who pay attention to everything from sanitation to sidewalk design, to local agencies that inspect houses and housing materials to make sure they are safe. When upstream solutions are put in place, such as increasing car and fuel efficiency, it affects the health of people downstream who enjoy better air quality. And these actions can have cascading effects. For example, implementing better air quality allows more people to exercise outdoors, further improving their health and reducing the physical, social, and economic costs of health problems like asthma. While we don't always see upstream environmental health professionals at work, what they do makes all of our lives better and healthier downstream.
When we talk about environmental health in the United States, we're really mainly talking about protecting and ensuring that the air that we breathe isn't contaminated, and we're also not contaminating the air. We're also talking about the water that we utilize for drinking water, freshwater sources, whether that be through surface water or groundwater. So we also want to ensure that the wastewater that we're discharging back to the earth is not contaminated, and the water that we consume is safe to drink. So there's a variety of tests that we can do to ensure that. We want to ensure the soil that we rely on to grow like our food uh, is of a suitable quality to be to be productive. Um, and also, so we'll talk a little bit more about that later as we get into septic systems. And we're also talking about a variety of food services, restaurants, facilities that provide food for us. As a consumer, especially when we're talking about the restaurant industry. So there's a number of different uh, safety programs that we have in place to ensure that the food that we consume is safe. And we'll also talk about a variety of other programs, special programs, PFAS, lead, and rabies later in our presentation. We don't have an air quality testing program at DHD 10, but the state of Michigan does, on the other hand. So there's a variety of uh, testing sites um, that are monitored throughout the state. Those are reported, but air quality is a big is a big concern, especially in the last few weeks. Uh, Multiple areas throughout Michigan, including many other states in the Great Lakes region, have seen the impacts of air quality, not from a regional level, but from from a long ways away, including referring back to all the wildfires that were going on up in Canada, how shifts in I'll say just the 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 currents, the high and low pressure zones, um, heat domes, if you will, how the circulation of the air on a regional and national level can have huge impacts in other areas across the country. In recent years, California has also experienced a number of large-scale wildfires. And now, when we're moving into larger discussions um, and talks about climate change, this is also one of those areas that is of high importance because we're having larger extreme wildfire events, flooding events, more extremes in weather. So air quality is one of those that really impacts us all. And uh, so what we're talking about here specifically is not just wildfire smoke, but ground level ozone. So the cars and buses that we put out on the roads and freeways, they all have carbon emissions from exhaust, and those particulates can have a negative impact in our ozone. So, in talking about particulate matter, what we're really concerned about is this real small particulate matter of 2.5 or less. Those small, tiny particles can get down deep within our lungs and cause a number of different more serious health impacts, especially to younger children, adolescents, elderly people, and other people with other types of asthma or upper respiratory illnesses. So we definitely want to be mindful and ensure that the air that we're breathing on a daily level is also healthy. When we're choosing a water supply source, whether that be for personal, residential, personal use, or whether that be from a larger municipality, from a water treatment plant. We want to be mindful of the source of that water to make sure that it's not contaminated so we don't get sick. The water source can be compromised in a number of different ways. Generally speaking, groundwater is our safest option, our cleanest water that we can consume, because there's aquifers have water source that is filtered due to all of the soil that acts as a filter, if you so to speak, to filter out a variety of different contaminants and microbes that might cause us to be sick. So surface waters, and including groundwater, if we're not mindful, can be contaminated in a number of different ways throughout the industry. Fertilizer from agricultural practices, pesticides, herbicides, a variety of farms, agricultural manure runoff, other types of factories and industrial manufacturing and processes, even from residential systems. We can have and do have septic systems do fail. We'll talk about that later, but you can also have leaky septic tanks, damaged, impacted systems that leak and contaminate local nearby river or another body of water, a lake. So there's a number of different things that we can do to ensure that a resident is consuming safe water. If you ever have questions about the quality of your water and you want to have it tested, we do have a water lab that can test for a couple contaminants. We do test for bacteria or coliforms. That's an indicator. If you have positive coliforms in your water sample, that's an indicator that you could potentially have a problem, but there's a number of different coliforms. So we want to, if you are positive for coliforms, more analysis can be done to see if there's E. coli, if there's fecal matter in that sample. And also, we can also test for nitrates, and water that has high levels of nitrate can be detrimental to especially infants and younger children, because it inhibits the blood to carry oxygen, and that's referred to like a condition as blue baby syndrome. I'm not going to spend just too much time on this slide. Clearly, soil has a vital role in our just overall well-being. We just about everything that we almost consume, at the dinner table is derived or comes from earth or is grown. So we do rely on having a soil system that isn't polluted, so that it can do what it needs to do, and it can be grow healthy and have a healthy food supply. But also, when we're talking about landfills, how we dispose and get rid of our waste, household waste, hazardous waste, solid waste, that all can play a large impact on our water supply underneath, a groundwater supply. Landfills were not always lined. It is a requirement now that landfills have to be managed in such a way that be lined with plastic and covered appropriately with cover, so that leachate doesn't run from the landfill and contaminated water supply. But even with these safeguards in place, everything does ultimately eventually fail. So if you are disposing of or need to dispose of hazardous waste around your home, check your labels. And there are a variety of other centers um, locally or at a regional level that can dispose of those types of waste. So any type of hazardous waste, radioactive waste, those all go into and are managed differently than a normal landfill. So ultimately, our main mission and goal here at the agency at DHD 10 is to protect the health of the environment in which residents live, learn, work, and play. And we do that through a variety of ways. And we do that through education, our inspections and evaluations programs, and a variety of testing services that we provide. Environmental health has probably a little over 20 programs all total. This is just a snapshot of a few of those programs that we kind of keep track of overall performance and tracking for a yearly total. This covers all of some of those programs and types of activities that we've been involved with or are involved with for fiscal year 2022. So this would cover from October 1st, 2021, all the way through September 30th, 2022. So generally about each year we do between 2,000 and 2,500 well and septic permits, give or take. We've got about 1,000 or so type 2 facilities, and all of those type 2 facilities have to have a survey on the backflow, evaluating their water supply every 5 years. So that comes out to be roughly about 10% or so, I would say, of our clients or our customers needing a sanitary survey every year. Also, we do final inspections on septic systems and wells. We do, it's a mandate, NPR, that we do a final evaluation on 5% of all water wells and 90% of septic systems that are installed. We do a final inspection to make sure everything is good to go. We make sure that proper isolation distances are met and the conditions in which that the sanitarian implied on the permit that that system was indeed installed correctly per the requirements of the permit. Generally, and also we fluctuate between somewhere around 940 to 980 food establishment inspections. And for FY22, we did just over 1,700 routine FSC inspections. Those include fixed facilities as well as STFUs, TFEs, food trucks, that kind of thing. And we also issue out and inspect temporary food facilities if they're looking to just have like a temporary food inspection. We also allow those. We inspect on a yearly basis all the campgrounds and swimming pools. And so this just kind of gives you a good idea of kind of what we're involved in. We have a variety of programs that inspect and evaluate on some level or another septic systems from a residential or commercial perspective. We do that through sanitary surveys, other inspections, evaluations like mortgage evaluations, BPAs, and also we do that through our permits, final inspections, and also doing our point of sale program in Manistee and Kalkaska County. So we'll talk about a little bit more about those in the slides to come. So in discussing the adoption of a statewide sanitary code, this topic has generated a lot of state attention from a variety of legislatures, senators, a variety of water resource rights and advocacy groups. Michigan is actually the only state that does not have a universal sanitary code. There's a variety of reasons for that. One being Michigan's geology. So of all the 45 health departments operating with jurisdiction across the state of Michigan, there are 45 different sanitary codes. As I mentioned, Michigan's geology plays a large factor in that. We have a very diverse range of geological features from a soil perspective throughout the state of Michigan. Luckily, in our district, we have pretty favorable soils for effective treatment and installation of septic system. Most of our soils that we have throughout our district, fine to medium coarse sand. If you get into other areas of the state, especially more the eastern side of the state, you have a lot of clay. So that presents a lot of challenges. But there are two current House and Senate bills currently at the legislature. We'll have to see what all or if anything becomes of all that, but it would require that all septic systems be inspected once every 5 years or on one of the three following triggers below. If you had a complaint with a reasonable cause, the property is going to have proposed increased use, going from like a seasonal cottage where an individual or family might only be up there 1 week a month to maybe it's more of a permanent residence. And also if the building is applying for permit construction of additional structure, meaning potentially that the size of the current system is too small, and it wouldn't therefore be sized appropriately for increased use. So certainly if a universal sanitary code passes, it would impact us tremendously. I just don't know how the work would get done with the staffing that we have, and also how it would be funded. Approximately throughout our district, we have right around we're estimating about 164,000 residences that have their own septic system, meaning they're not connected to a municipal supply. And it would mean that we would have to be doing over 32,000 evaluations district-wide each year. The slide that you're looking at now is just sort of a summary of the number and the types of septic systems that we've installed throughout the years. By and large, the vast majority of septic systems that are installed are conventional gravel bed. It just means that you've got a layer of 4-inch PVC pipe all laid out in rows. It's sitting on a bed of stone, and then you've got your pipe, and then it's covered by another layer of stone, and then covered by a foot or two of topsoil, of suitable soil. We also install a number of there's a wide array of systems that are installed. We still do have a number of dry wells throughout our district. These systems are generally very old. Right now, we probably only permit maybe one, maybe two dry wells throughout the course of a year. I'm certainly not they do a very, they don't do a very effective job in treating effluent. We also install what's becoming more and more popular is the use of alternative treatment, the use of like geosynthetic or textile components. Some of those becoming in popularity, although they're a little bit newer. You've got an Elgin system. We also install an easy flow system, and chambers is another one that we do install, and a wide variety of low pressure beds, mounds, systems that have to be elevated to treat effluent because you have a high water table. We'll talk about those in the next slide. This slide here is just kind of give you a little bit of visual perspective, if you will, on just some of the common systems that you can see or that we install. The most common one that we do install is just a traditional conventional gravel bed system. Here you've got your septic tank, you've got a fairly high riser, you've got an out pipe here coming from your septic tank, and then it flows out through generally about a 4-inch pipe, approved pipe, goes into a header, and then it flows out gravity flow through through the other remaining pipes or footers, if you will. So you've got a header, a footer, you've got the other laterals, if you will. So the laterals are taking the laterals all are perforated pipes, so it's taking all of the effluent from the septic tank and into for further enhanced treatment of that effluent. We also install, in some instances, where if you have high groundwater table or seasonally high water, we have to have 4 feet of suitable soil from the bottom of the drain field to the height of groundwater, or seasonal high groundwater. So it's essentially sort of like a gravel bed system, only it's elevated. And the bottom here is just a picture of a chambering system. So you've got a number of different plastic chunks, if you will, pieces that all snap together, and they're just laid uniformly parallel and level throughout a system.
This slide shows a number of items that can affect the lifespan of a septic system. Moving from left to right, parking a vehicle or planting a tree too close to a septic system can break the tank lid, or crush the lateral pipes in the system, causing premature failures. Moving into the house, flushing disinfectant wipes or other materials down the toilet that do not decompose the way that toilet paper does can reduce the inner volume of the septic tank, leading to premature failure. In the kitchen, using a garbage disposal increases the number of solids that enter the septic tank. The more solids enter the septic tank, the longer it takes that system to break those solids down before releasing them out into the drain field. If they don't have enough time to be broken down before being released out into the drain field, they will plug up the drain field and lead to premature failure. This slide shows the number of variants, red tag, or denied permits by county. Numbers increase as the total number of septic permits in that county increases. As you can see, the number of variances greatly outweighs the number of red tags or denied permits. Overall, we denied very few permits district-wide. This chart shows 2 permits denied, one in Kalkaska and one in Mecosta, during the 2022 well and septic season. A number of items affect the lifespan of a septic system that occur at the installation or during the operation of that septic system. A toilet running constantly because the float needs adjustment in the back can introduce extra water in the septic system and lead to premature failure. If a septic tank is made of metal or other material that decomposes over time, failure to the actual physical tank can cause solids to enter the drain field and lead to premature failure. Also, if a contractor installing a gravel drain field purchases stone that has dirt or a lot of fine sediment in it, this can clog the soil lying underneath the drain stone and can lead to premature failure. Although there is no mandated point of sale, POS, septic inspection program within the state of Michigan, District Health Department number 10 has a requirement for a point of sale inspection of septic systems in 2 of our counties, Kalkaska and Manistee. Each of these counties did approximately 300 point of sale inspections during the year 2022. Kalkaska doing slightly more. The inspections are completed by private contractors. They are identical to a mortgage evaluation inspection that you can purchase for us to complete in any of our counties, including Kalkaska and Manistee. But these are mandated by our sanitary code in those 2 counties at the time of a real estate transaction. Once the inspections are complete, the private contractors send an inspection report to our office for a review, and we approve it and sign it before placing it in the property's street file. When well and septic systems are inspected, the inspector is assessing them for how closely they comply with current or existing code. Systems are given a level of priority if they do not fully comply with the current sanitary code, but are not in a state of failure in any way. Failed systems are required to be repaired under our sanitary code by permit, although systems undersized are given anywhere from a priority 1 rating of substantial hazard to a priority 4 deviation, in which we just make a statement that the system doesn't fully comply with the size requirements of the code, but it's functioning properly and can continue to function into the future until the time of failure. We usually add a statement to most of our reports regarding undersized systems that mentioned future systems will be installed through permit by this office and must meet all of the requirements of the code at the time of installation. This slide shows the status of septic systems that were inspected in Kalkaska versus Manistee County. In Kalkaska, 46%, or about half of the systems, were reported to be in compliance with the current sanitary code. In Manistee, that number was less, although the number in compliance and receiving a deviation because they were very marginally out of compliance was close to 50%, very similar to Kalkaska. Very few systems were identified as being in a state of failure during these point of sale inspections. In Kalkaska, 1% were in a state of failure. None were reported during 2022 in Manistee County. When septic systems fail, sewage can be released into the environment before it's properly treated to remove nitrogen and phosphorus. This can lead to surface water contamination of lakes and streams, which can cause algae blooms or other weed species to form in those bodies of water. Contamination of aquifers can impact drinking water wells and affect public health. Wastewater that is untreated from failed septic systems entering surface water or a high groundwater table surrounding a body of surface water can lead to algae blooms. Blue algae can form a toxic substance called cyanobacteria, which is deadly to animals and livestock. This is very similar to the slide on the status of septic systems between Kalkaska and Manistee. This applies to the status of water supply wells and the risk associated with their construction. All water supplies inspected in the point of sale program are sampled for bacteria. So we know that all systems are free of bacteria, although the risk categories applies to the construction of those wells and how closely that complies with current well construction standards in the state of Michigan. The majority of the wells are a minimal hazard or in compliance with the current well construction code. Water that is not treated or filtered is not safe to drink. Untreated water can contain toxic substances and disease-causing bacteria or parasites. If a well is too close to a septic system, wastewater could leach into the drinking water well and cause illness. Water supplies such as wells are treated for coliform bacteria and E. coli with chlorine. Nitrates can leach into drinking water supplies and can cause serious health impacts as nitrates reduce the ability of blood to carry oxygen. Infants and children one age and under are more susceptible to this condition, which is referred to as blue baby syndrome. The EPA recommended maximum level for nitrate in drinking water is 10 parts per million, or milligrams per liter. Drinking water laboratory services are available through District Health Department number 10 at our drinking water laboratory located in Ludington at our office at 916 Diana Street. The cost per sample is $20 for bacteria, $20 for nitrogen. We also can sample surface water for bacterial contamination or nitrogen. District Health Department number 10's drinking water lab received 4,006 water samples for coliform bacteria in 2022 and 1,413 nitrate samples. Of the bacteria samples received, 606 were positive. If I do the math correctly, that represents less than 20% positive rate, which is pretty good. Positive nitrates, I think that should say nitrates exceeding 10 parts per million or milligrams per liter. 21 nitrogen tests exceeded that EPA threshold of 10 milligrams per liter of nitrogen in drinking water.
Hi everyone, my name is Katie and I am one of the public health educators with District Health Department number 10. And at this time, I'm going to move us into talking about DHD number 10's involvement with food-related activities. And as you can see on the screen, this includes our inspections and evaluation, the permitting process, the merit awards that the health department gives out, as well as foodborne and other environmental related illnesses. This slide highlights the number of food inspections DHD number 10 completed in 2022 in each of our counties. As you can see on the screen, these were done across fixed food inspections in the green, mobile vending and STFUs, which are our special transitory food units, or you can think about those like food trucks. They are in the red, temporary food inspections in the yellow, and follow-up food inspections in the blue. I'll give you a moment to take in this screen as there is a lot happening here. This slide highlights the number of procedural violations documented in 2022. And the way you can read this slide is the box there on the right with the numbers corresponds to the graph on the left. So column number 1 there on the graph would be improper handling, storage, or labeling of toxic items. Column number 2 would be improper date marking of foods, and so on and so forth. Overall, the number of violations was considerably lower when we compared those to 2021. Most notably, in column number 8, the number of foods from unapproved sources, we saw a 68% decrease from 105 violations in 2021 to 34 violations in 2022. A decrease was also seen in the violations issued for improper cooling of foods in column number 11, going from 85 violations in 2021 to 52 in 2022, a 38% decrease. This slide is showing us the physical violations that were noted in 2022, and similar to the slide before, you're going to read this the same. So for 2022, the violations were rather consistent with those from 2021. The most notable increase was in poor design maintenance and cleaning of food contact surfaces, which is column number 1. We saw an increase from 100 violations to 129 in 2022. The agency did observe a decrease in the number of violations in improper mechanical washing of dishes, which is column number 3, citing 49 violations in 2022 compared to 72 in the previous year. All other categories in this grouping were consistent over the last 2 years. The final violation slide that I want to highlight is with our support violations. As with the previous 2 slides, in general, the support violations were consistent from 2021 to 2022. As with 2021, the lack of a chemical test kit in column number 5 and lack of hand drying methods in column number 4 were the highest violations noted, but still showed a decrease of 23% and 35% respectively. All of this to say the agency has done a really good job at educating our retail handlers so that we are seeing a decrease in these violations. I'm now going to turn it over to Lacey, another one of our health educators, to talk about permits, merit awards, and food and other environmental-borne illnesses.
The graph on the left shows how many temporary food permits were given between 2017 and 2022. You can see that there was a small gradual increase in 2017, 2018, and 2019, with a very low dip in food permits in 2020 because of COVID. And since we have been slowly increasing our numbers to get back up to where we were back from 2019. The graph on the right shows the percentage of temporary food permits given in each of our 10 counties back in 2022. Oceana County had the highest with 32% and Crawford County with the lowest at 1%. The health department does give out merit awards, and the conditions for a merit award are no repeat priority foundation violations on the last 2 inspection reports, no priority violations on the last 2 inspection reports, no valid complaints for the evaluation year, no valid foodborne illnesses for the evaluation year. Here are merit awards given back from 2022. Mecosta County had the highest with 63, and Kalkaska County had the lowest with only 1. Food and other environmental-borne illnesses. District Health Department number 10 and other local health departments are required to investigate and document certain diseases that pose a significant risk to public health. So these diseases would be something serious that could result in death, and it's important that we actively work to prevent the spread that when they do occur. Examples might be respiratory infections like tuberculosis or TB, maybe even vaccine preventable diseases like chickenpox. Um, Also, the diseases that we get from our environment. Some might happen when we're eating or drinking food or water that is contaminated with viruses, bacteria, or parasites. An investigation would include many staff, including public health nurses and sanitarians. They would be contact tracing, working with other healthcare authorities, interviewing, and more to find the source and to stop the spread. I won't name all of the listed conditions on this slide, but the chart shows our numbers on each condition for 2018 through 2022. The 2018 through 2022 column are the total counts for each disease that year. If the 2022 rate is lower than the 5-year rate, that is good. It means we had a decrease in cases. If the 2022 rate is higher than the 5-year rate, that is bad. It means we had an increase in cases. Overall, though, our DHD10 rates were lower than the Michigan average last year for each disease. This is likely due to the impact of COVID-19 restrictions that were put in place to reduce the spread of COVID-19. In turn, it also reduced the spread of other communicable diseases. It will likely take a couple years to see how we actually rebound and if our rates are going up again or remaining the same or going back down. This graph is comparing the rates of each of these foodborne illnesses by county. Rate per 100,000 means if we were to randomly pick 100,000 people in your community, then this is the number of cases of each disease we would expect to find. This would include the counties that don't have a population of 100,000. It's just a calculation based on the actual number of cases and accounts for differences in population sizes. It allows us to directly compare counties to counties and counties to the state and the U.S. Kalkaska County had the highest rate of foodborne illnesses in 2022. The lowest rates were in Manistee and Mason County. Most cases were Campylobacter and Salmonella, which is not surprising considering these are the two most commonly occurring foodborne illnesses in our area and across the U.S. as well. Moving on to other environmental health factors, I'll discuss vector-borne illnesses, rabies, radon, and lead. Katie will discuss PFAS, and Mick will close out the summit with complaint investigation. Vector-borne illnesses. A vector is a living thing such as a tick, a mosquito, or flea, and they carry diseases. They are most common in our lakeshore counties. Anaplasmosis is a disease that is carried by ticks. Symptoms would include fever, headache, chills, muscle aches, nausea, vomiting, and loss of appetite. These symptoms would begin to occur within 1 to 2 weeks of the bite, and if left untreated, it can lead to respiratory failure, bleeding, organ failure, and death. Lyme disease is another common disease carried by ticks. Symptoms include headache, fever, fatigue, a circular or bullseye rash, and a migraine. Long-term side effects would include muscle weakness and kidney failure. Rabies is a viral infection carried by bats, raccoons, skunks, and foxes. However, it's most common in bats, which accounts for 7 out of every 10 rabies deaths. Symptoms are flu-like, which include weakness, discomfort, fever, and headache that progresses to brain dysfunction, anxiety, confusion, and agitation. Fortunately, rabies infections are rare in humans. However, once symptoms occur, it's almost always fatal, and death occurs within 4 months of the symptoms. DHD10 does accept animal specimens for testing. We accept the head of a small mammal, and we send that mammal out for testing. Potential exposure prophylaxis, also known as PEP, is treatment for people who believe that they have been bitten or scratched by an animal infected with rabies, and it prevents the infection from occurring. The graph on the right shows the number of people who came into the health department for PEP treatment in 2022. Oceana County had the highest, with Missaukee County having the lowest at 0. Next up is radon. Radon is an odorless, invisible radioactive gas naturally released from rocks, soil, and water. It seeps into our homes and buildings and builds up over time. Breathing high levels of radon can cause lung cancer, and it's currently the second leading cause of lung cancer behind tobacco use. It's estimated that roughly 21,000 deaths occur annually. We strongly encourage testing, especially if your home has never been tested, or if you're preparing to buy or sell, or if you spend large amounts of time in your basement. Radon test kits are available at the health department. They are free during the month of January, since January is Radon Action Month. February through December, test kits are $10. Winter months tend to be the best time to test because your home is closed up and there is limited airflow. The graph on the right shows that in 2022, 444 tests were distributed. 261 were sent to the state for evaluation, and 33 tests came back with high levels. The graph on the right shows how many radon tests were distributed in each of our counties in 2022. Mecosta had the highest number of tests distributed and also had the highest number of tests with high radon levels. Moving on to lead. Lead is a naturally occurring toxic metal found in the earth. Children under the age of 6 are at the highest risk of lead poisoning, which can lead to behavior and learning problems, low IQ, slowed growth, anemia, and hearing issues. Pregnant women are also at risk. They can have premature birth, higher risk for miscarriage, and it can also hurt the baby's development. Adults with lead poisoning tend to have high blood pressure, decreased kidney function, and reproductive issues. Lead is found in the air, soil, water, and in older homes. If your home was built before 1978, it is more likely to have lead-based paint. This is because in 1978, the federal government banned lead-based paint. However, it is still found under layers of newer paint. Deteriorating lead-based paint, such as chipping, cracking, or peeling paint, is hazardous, and it can be found on hard surfaces that have quicker wear from use, or areas children and babies can chew on, such as windowsills, doors, stairs, railings, banisters, and porches. DHS says that elevated blood level for children is now at 5 micrograms to 3.5 micrograms. Lead testing is strongly encouraged, especially for children, and children enrolled through DHD 10's WIC program are eligible for testing. For children not enrolled in WIC, we strongly encourage that a parent or guardian consult with a healthcare provider. We do high capillary blood testing, and if those results come back high, we then perform a blood draw. Those test results determine if case management is necessary. Trained nurses then educate the family about how to reduce lead levels, and mitigation is then discussed. I will now pass it off to Katie to talk about PFAS.
I'm going to finish out our presentation today talking about per- and polyfluoroalkyl substances, or better known as PFAS. And before I get into this topic, I just want to let everyone know that this is going to be a very high overview of the topic. There is lots of information that I could have provided you today, but for the sake of time, we just picked some of the highlights to share. So, what are PFAS chemicals? PFAS is a class of man-made chemicals that have one of the strongest bonds in chemistry. They act as surfactants, which reduces a liquid's surface tension and increases its spread. They're highly stable, and they repel water, oil, fat, and grease. The industry began developing PFAS compounds in the 1940s, and there are over 5,000 different kinds of PFAS compounds today. So, what is the concern? Why are we concerned about PFAS? We're concerned because they are widespread in the ecosystem. They don't break down easily and are hard to get rid of. PFAS is known to bioaccumulate, which means they build up in our bodies and in the bodies of fish and wildlife. Some PFAS may affect health, and I'll go into that a little bit later. And with over 5,000 chemicals, we don't know a lot about them. So there's some emerging science and information, but there's still a lot that is unknown, and there is a lack of national standards. I really like sharing this image because it shows many of the common uses of PFAS. So PFAS can be found in things like carpets, carpet cleaning products, food packaging, furnishings, cosmetics, outdoor gear, clothing, adhesives and sealants, protective coatings, nonstick cookware, car seats, and most notably known firefighting foam. And again, it shows you just how widespread PFAS can be throughout the environment. This diagram is one that I also like to share because it shows two things. The first being how PFAS could cycle through our environment, and the second being places that MPART would likely sample. And MPART, for those that don't know, is the Michigan PFAS Action Response Team. So there's a lot happening here on this image, and I'm going to take us from the top left all the way to the top right. So we're going to start with PFAS producing and using industries. If an industry creates and uses PFAS, they could be discharging wastewater into the ground or into a river or stream. So that brings us directly to the bottom left of your image. Industries could also be sending wastewater to a wastewater treatment plant, which brings us to the center of our image there with the wastewater treatment plant. And these plants are not designed to treat for PFAS. So a treatment plant could discharge the water directly into a river, so bringing us to the bottom middle of our image. Or wastewater treatment plants also deal with a compound called sludge that may contain PFAS, which could end up in our landfills. So that brings us to the top middle of our image. With our landfill, we're worried about the ingestion of the air for our residential homes. So that's one pathway that we're worried about. But going back to the wastewater treatment plant there in the middle, we are also worried about biosolids. So wastewater treatment plants can land apply biosolids where any PFAS could be taken up by plants. Another avenue, if not through plants, would be through runoff to the river or ending up in our groundwater. So now we're kind of at the bottom right of our graph here. So we're worried about the biosolids getting into the groundwater, and we're worried about the groundwater then being uptaken by plants, ending in our food products. So if it gets into our food products, ultimately it could lead to being ingested by consumers in the residential home. Or if we see PFAS infiltrated into the groundwater, we can also see through drinking water that it can get back into our homes there, and people could be drinking contaminated drinking water. So we're moving PFAS all through our environment, and now the challenge is trying to understand the occurrence of it and how we can break that cycle. As I mentioned earlier, there could be several exposure pathways to PFAS chemicals. And what we're worried about the most is the ingestion of PFAS. So that could happen through eating or drinking contaminated material. So drinking contaminated drinking water could be an exposure pathway. Eating fish caught from water contaminated by PFAS could be another. And if you're interested in learning more about this, I would highly recommend you check out the Eat Safe Fish guidelines using the link on this slide. The Eat Safe Fish guidelines are going to help you learn how to choose safer fish to eat and find out if you're at risk for chemicals commonly found in fish. And it's divided into different regions. So you can see all over Michigan the recommendations for different kinds of fish and how much you should eat. Incidental swallowing of contaminated soil or dust is another potential pathway. Eating packaged food and material containing PFAS, or using some consumer products. I do want to mention, though, that PFAS absorption through the skin is typically not a concern because it's not that ingestion pathway. Long-term exposure to PFAS chemicals can cause health problems, though they may not be seen immediately. As I mentioned earlier in this presentation, there's not a lot of information that is known about PFAS, though there are two chemicals, PFOA and PFOS, that there is a little bit more information about. And these two specific chemicals can cause certain human health outcomes. Reduced fertility being one of them, high blood pressure or preeclampsia in pregnant women, small decreases in infant birth weight, higher cholesterol, especially total cholesterol and LDL cholesterol. Long-term exposure to PFAS chemicals can also contribute to human health outcomes such as thyroid disease, liver damage, decreased immune system responses to vaccines, and specifically for the PFOA chemical, an increase in developing certain kinds of cancers, particularly kidney and testicular cancer. I would be remiss if I didn't share with you all during this presentation the MPART website, which is seen here on the screen. So as a reminder, MPART is the Michigan PFAS Action Response Team, and they are charged with leading the investigations of PFAS in the state of Michigan. So their website is michigan.gov/PFAS response, and it truly is a hub of all the information you could possibly imagine when it comes to PFAS in our state. They have an FAQ that you can look up frequently asked questions that people are asking, drinking water recommendations, sites within Michigan, which actually leads me to the right side of this slide, which is a screenshot of the state. And as you can see in the upper left-hand corner, it says 252. 252 is the number of PFAS sites within the state of Michigan that MPART is investigated. And District Health Department number 10 has several sites that we are also partnering to investigate, which I will get into on the next slide. The role of DHD number 10 in PFAS investigations is to be aware and understand the health concerns that are facing our community. We are also charged with leading the public health planning and response according to EGLE and MDHHS's site investigation and their recommendations. So these recommendations could come down to three things. Recommendation number 1 is no public health actions necessary. This could come about because the PFAS site does not affect any drinking water wells in the area, and so no public health action may be necessary there. Recommendation number 2 could be that a resident needs to use a filter or alternate water source because PFAS is affecting their drinking water well. And so in that case, the health department would come in and offer a point of use filter or bottled water in jugs of water until that filter could be installed. Recommendation number 3 could be that we provide education on PFAS in drinking water. Maybe in scenario number 1, there's no residents that are affected by PFAS directly, but it is a concern in the community, so the health department should go out and do some education to inform those residents about what their community is facing.
As we wrap up today's summit, we'd like to share how to file an environmental health complaint with District Health Department number 10. The complaint form can be found on our website under Forms and is named Complaint Form. Fill this form out for complaints regarding sewage, surface and drinking water, trash and garbage, pest control, or food establishment. Once completed, the form can be mailed to the nearest DHD 10 address. Thank you for joining District Health Department number 10's 2023 Environmental Health Summit. For more information on environmental health at DHD 10, please visit our website at www.dhd10.org. or contact the office nearest you using the phone numbers or email addresses listed on this slide.